Ray, a John Maxwell certified leadership coach. Welcome to Life, Love, and Leadership, where we discuss everything pertaining to life, love, and leadership. Let's get started.
Like, no doctor's ever done that to me before. What are you doing? Why are you tapping here? What are you doing this? And like nobody's ever done that before. Like this is medical school 101. This is, you learn in the first year how to do a physical exam, and a lot of doctors, they aren't doing them.
Hello and welcome to Life, Love, and Leadership. I'm Tom Ray, and I'm so excited today because joining me on the line is Dr. Cardellio. He is getting ready to launch something really great here in the next week or so, but we'll get him into more of that in just a little bit. But before I start the show, I like to always kick off with an attitude of gratitude. And today I'm thankful for second, third, and fourth chances. I'm thankful for opportunities to be able to do it again, to start again, for new beginnings. And that just because we make a mistake doesn't mean that has to define the rest of our life. That there is a new beginning, a fresh start, and another opportunity. And joining with me, Dr. Tony Cardellio. He's here today. And Doctor, can you tell us what you're thankful for today?
Well, I'm thankful to be here with you, Tom. And as I said, I've had an amazing journey over the last year. It's really been driven by a lot of prayer and direction. And I'm thankful that God has guided me to this point where I'm at. And much blessings upon my family and this opportunity to hopefully connect more time with my family. And I'm very grateful for that opportunity. And that's what I'm most thankful for today.
Great. All right. Well, that's wonderful. And it's also inspiring. And I think a lot of people resonate with that today. So I'm so glad to have you on the show today. I got to hear part of your story, kind of the kickoff to what's about to come.
Yeah, we had a couple of informational sessions that we held at a banquet center just to invite community and some of my existing patients in my practice just to find out more about the practice that I'm starting up with the group Salta Salta Direct Primary Care that I'm joining. So the Direct Primary Care is not a new type of practice, but it's new to the Shelby Township area. More and more doctors are sort of trying to get into this to have a better practice life and practice medicine a little bit more on their terms instead of terms of hospitals and insurance companies. So that was one of the events that we had. It was a 2-hour question and answer at a nice little facility there in Shelby Township, Shelby Gardens. The staff and everything was wonderful there. I walked in the first day, I was like, oh, this is like my wedding reception. This is it was very fancy, but it was a very good informational session, and it really kind of helped to get the message of what the direct primary care is out there to the community. So it was very nice.
Yeah, very nice. And I was connected to it through a mutual person that we know, Kimberly Stevens. Mm-hmm. She's the one that actually connected with me. I met her at a networking event, and she invited me to come out to be a part of it. And I got to hear some of your story and was really inspired by it, and thought that this would be a great platform for you to share your story, your journey, your dream, if you will, of becoming a doctor, and as well as what is coming with the direct care, as you mentioned just a moment ago. So why don't you give us some background story to you becoming a doctor, or why you even went in that direction in your life?
Well, I think even from when I was younger, I was, kind of had the idea that I wanted to be a doctor. I was very interested in the human body, anatomy, and memorized all the names of the bones when I was in second grade. I remember that, and having competitions in our biology class. My father is a doctor. My uncle is a doctor. My father's a dermatologist. My uncle was an ophthalmologist. My sister's going in medicine, is in dermatology with my father. So a little bit of background and history there. So, it was something I was familiar with, but it really kind of resonated with me. I just, really, especially, so I went to osteopathic medicine. So that has a lot of integrated hands-on. We learn all the different techniques for doing manipulation for spine, joints, and extremities. And I love that aspect of holistic healing. So that was something that really kind of resonated with me, because I saw my father do some of those adjustments every now and then on family members, and I was just always fascinated by that. It was just really interesting. And then just as I kept on going through, junior high and high school, it's like I always had aptitude for the sciences, and it just made sense for me to go ahead and do that. And that's where I ended up going to Chicago osteopathic medicine, and then coming back, finishing my training here. And then I've always been in practice in Shelby Township somewhere. So our office has kind of moved locations as we've grown and joined with at first I was just private on my own with a partner, and then we joined with St. Joe's, which soon became Henry Ford, and I've been with Henry Ford ever since. So that's been, I just, when I resigned, my last day at Henry Ford was last week, and it had been 16 years and 6 months that I've been with the organization. So it was a long journey, and this was 51 years old, and I'm starting all over again. So
that's wonderful. So what you currently do, you do chiropractic care as well as general medicine, or what would you say?
Yeah, so it's kind of a blend. So osteopathic medicine has, the osteopathic profession was created and founded in 1874, so it's been around for a long time. So they do integrate more holistic sort of thoughts and ideas. Their philosophy has always been mind, body, spirit, and trying to integrate those three together, which kind of falls into both how I see things and how I interpret my faith now, and try to include that into my practice style and my life, because you really can't separate the three. If you ignore one, you're sometimes missing the diagnosis, and you're missing the boat. So that really kind of drew and called me, that style of profession. So all osteopathic physicians do learn from day one how to do spinal manipulation and full body manipulation. I mean, they have techniques that you can manipulate somebody's pinky finger if it's out of joint or a line, which is a little bit different than chiropractic. Chiropractic generally tends to focus more just on the spinal issues, although I do know some chiropractors who've done extra seminars and training and learned some other, of the extremity manipulation techniques and things like that. So they're definitely out there, but then the osteopathic profession has the opportunity to then integrate a lot of the traditional medicine. So we do all the same training as MDs do. We do it's still a 4-year program. We do all the sciences, and we rotate through the hospitals and the specialties and do all that training, as well as integrating the manipulation into your practice. Now, I would say that a lot of osteopathic physicians do not do the manipulation, especially when you get to specialties. You have a neurosurgeon who's probably not going to do a lot of spinal manipulation. They're focusing more on surgery and taking care of other things. But usually that falls into family practice or primary care, who will do the spinal manipulation. But I can probably count on my two hands how many people I know that do it regularly in their practice. So I don't want to say it's a dying art, but it's something that I think a lot of people don't see the benefit of how it integrates into. So that's one thing that when I did my training, I had some great doctors that I worked with that's all they do is they give up their traditional practices, and all they do is the manipulation. So I got to train with them and see how they integrate that, and even doing inpatient work on patients who have had surgery or who have pneumonia or respiratory illnesses, and how you can do manipulation on the chest and the ribs and things like that to ease their breathing and help them heal a lot better and faster than just the traditional medicine way. So, and there's been some great examples, and in osteopathic medicine also, the manipulation aspect of things is very heavily researched. So, I mean, they have, every single college of osteopathic medicine has a research arm and program where they actually do studies, and they have fellows, and they publish and they document all the benefits and what happens when you integrate the manipulation into your practice. So It's very effective. It's very powerful, and I have even personally many examples of patients who had, probably thousands of dollars of workups for chest pain, and they're having a heart attack. Is that a heart issue? And it ended up being I just had to manipulate their rib, get it right in the back position, and their pain's gone instantly. And so, a lot of examples like that. It's not always that simple, obviously, but there's a great opportunity for that style of medicine to, in the osteopathic profession to do that.
Awesome. Have you ever heard, Doc, my arm hurts when I do this?
Yeah, don't do that.
Don't do that. Mine actually hurts when I do that. I think I got frozen shoulder or something, but I can resonate when you were talking about a person thought they were having a heart attack. I remember several years ago, I actually reached over to grab this empty box that was sitting next to me in the car and to lift it up and out. And I felt something pop in my back, and I thought I was having a heart attack. Just the pain was so severe. And then I started to panic a little bit because of that. And it was just something that had popped in my back, and it had nothing to do with my heart, but it was quite an experience. And so
and you go on Dr. Google, and you always the top two answers when you do any search for symptoms on Dr. Google is, like that. It's either you have cancer or you're about to have a heart attack or a stroke. So
right. Right.
Oh, what's going on?
Yes, and always running to the extreme. I was really blessed by seeing there was a couple hundred or maybe 500 people at the Shelby Gardens event.
Yeah, we had. I think that the first one we had about 170 people that showed up, and then the second one was a little bit less. We had about 120. And I think initially we had like over 200 people signed up, and a lot of people last minute, called back, oh, I got something else that came up and I can't attend now. A couple of people had COVID and didn't want to come and infect everybody, which was nice. So, yeah. It was a great turnout. So when we talked to the team at Salta Direct Primary Care, when they had done this with other physicians, they kept on telling me, it's like, this is, we've never had a turnout like this, or we've barely gotten 100 people to, come to some other events in the past when we've launched other offices. So they were very excited. I was very excited. And I do have quite a few patients that have been with me for a very long time, almost ever since I was in practice. I just, actually, I'm coming up on my, 19-year anniversary of being in practice this September. So, and I've had some patients that have been with me pretty much, almost the full 19 years. So, it was really nice to see.
Yeah, well, the part I was most blessed about, I mean, obviously there's a lot of people there. I was surprised by how many people were there, and then how many people were patients of yours. And there were several that just resonated about how you had changed their life. I actually sat to a woman next to me, and she said that you saved her life. And you made a huge difference in her, that she had spent all this money elsewhere trying to get herself fixed, and she was able to get connected through you and get her life back together again. And she was an older woman, but she was wanting to get back into the field again and working again. And so I actually had an opportunity to coach her in that moment and ask her what she would want to do. And she said she wanted to be an assistant to a world's top chef, a celebrity chef of some kind. So what an inspiration. And it literally just inspired me that she was at that point. And then she just gave you a lot of credit for making her better. And so I was thinking, what am I a part of right now to hear all this? And so it was such a blessing to hear those things from those folks. And then again, to hear your story of how you reached that moment in the room. And can you share any more about that, about maybe some pitfalls along the way that along your practice, maybe thinking that I don't know if this is going to work, or even now, obviously you're saying, that you're starting fresh and anew, and we'll get to that in a second. But even through the past, have you hit some pitfalls along the way that you thought, man, I don't know how this is going to go?
I don't think I ever really had that. I mean, I think that there was a couple of sort of external challenges when I started medicine and started practice. We were just starting an economic recession. That was the housing bubble popped, and people were losing homes and businesses, and there was a big. So I mean, I think the practice took a little bit longer than I thought originally to take off because of some of those external challenges, which is one of the drivers why we joined with the hospital, just to kind of offer a little bit more stability and security as we kind of grew the practice. But I don't think I ever had any concerns that it's like, oh, I'm doing the wrong thing here, or anything like that. And I think that as I just described, so what I described to somebody recently is that I've come to the conclusion that I've always been a direct primary care style of practice where you take more time and you get to know the patients more in depthly, which is sort of the point of the direct primary care is to get a more close relationship with the patient, know every aspect of themselves, their family, and not just rush them out the door. And I've always practiced like that. And that's, something that I love talking to people and getting their histories and figuring out, kind of what's going on. I have that little bit of Sherlock Holmes problem solving in me. So I like to do that. So, but it's nothing magical that I do. I just spend time with patients. They open up and they're more often than not, they're just grateful that somebody actually listened to them. And that can go a long way to just alleviating a lot of stress and anxiety in somebody's life about, I don't know what's going on with me. I don't feel well. And everybody else that I've seen so far has rushed me out the door. They do 1 or 2 tests. Everything's normal. And then, nothing ever changes. And then they come to me and they're like, I mean, even patients who don't have any complex issues, they come to me and I do my basic intake and exam on them. And and I don't know how many times I've heard over the last 19 years, like, what are you doing? I'm like, well, I'm examining your abdomen. It's like, no doctor's ever done that to me before. What are you doing? Why are you tapping here? What are you doing this? And like nobody's ever done that before. I'm like, this is medical school 101. This is, you learn in the first year how to do a physical exam, and people just, a lot of doctors, they aren't doing them, and they're not hands-on. You have to touch and listen to the patient, and you have to be close to them. And and I think that's in part, probably societal. Withdrawn. Everybody's pulled into their phones and their personal space, and don't get in my personal space, and it's harder to open up. But that's what I've always tried to focus on is just taking as much time as I need with patients. I do not, even if I'm running an hour behind, I don't catch up on the next patient and, oh, your appointment can only be 5 minutes because I spent an extra 5 to 10 minutes with somebody else. And patients really appreciate that. And you can really, I mean, that's the first thing that they tell you in medical school. 90% of your diagnosis is through the history. Physical exam is just, filling in a few little gaps and everything.
Yes, I've experienced both kind of doctors where I felt like I was a number, and then I felt like I was a person that the doctor cared about, to sit down with me and just take a moment and make me feel relaxed and not rushed, and not that I have to think of all the things that I was struggling with in a second so I could get a quick diagnosis. But just to be able to sit there and create an atmosphere of calm to bring us to a point to where we could have communication. And I think that's why the room at the Shelby Gardens was so packed with people who have been touched by what you do, literally and figuratively. It was so powerful to see that. I don't know if I could imagine any other any other moment like that where so many patients would come to support, rather than maybe the faculty, of the hospital and things like that, people who work with you all the time, but actual patients showing up. And that's pretty awesome. Rock star moment for sure. And it's pretty cool. So, I think that you mentioned in the session that you were making this shift, and one of the benefits of that is for family, for your family, having more time for that.
Right.
Let me pause on that just for a second. One of the things that was shared, it was the amount of patients that a doctor sees is incredible. I didn't realize it was that many. Like 2,000, was that right, or something like that on an average?
Yeah. So I think the national average for primary care physician is 2,400 patients that you have on your, hospitals call them your panels, insurance company calls them your patient panel. But those are patients that typically you've seen at some point in the last 2 years. So you've had some sort of contact with them in the office, and so you're sort of actively managing them. So some people use 2 years, some people use 3 years. So within that 2 to 3 year time frame, that's the number of patients that you have actively been treating and managing. My panel with Henry Ford was over 2,700. I think it was 2,750 or something like that. So I was even, several hundred above the national average. And for our Macomb network, I had the highest patient panel of, all the doctors in the network, and my partner had the third highest. So, we managed a lot of patients. And in part, what comes with that is that, there's a lot of things that you have to do, and there are sometimes just small little quick things, but when you have 2,700 patients, that really adds up. And the challenge over the last 6 or 7 years is that with all the insurance changes with I don't know the full name of it, but we just call it Obamacare, that changed a lot of criteria for what your staff can do. So the government kind of stepped in and put all these guidelines on. Okay, well, your front desk staff, they can't talk about anything clinical because they're not clinically trained. So they can't even tell patients, the old, oh, well, take an aspirin and call me in the morning kind of a thing. Oh, I got a little bit of a fever today. It's like, well, our staff in the past always used to say to them, it's like, well, if it just started today, it was kind of standard. And we trusted them to, say, oh, you can take some Tylenol and Motrin over the counter and make sure you get a little bit of rest and fluids today. A lot of times you're going to have a fever or things like that in the first couple of days. And, it's not always, good to be seen on the first day of symptoms because, you don't have the full picture. If it persists over a few days, then give us a call. So they're not allowed to do that. They're not allowed to, even our medical assistants, even though they have a little bit more medical training, they still don't want them giving out. It's against the sort of their credentialing and their training because their level of license and training is not as high as, say, a nurse would be. So they can't even do that. So, without hiring a nurse for your practice, which, is more costly and, financially difficult for things and, with budgets and stuff like that, we didn't have that resource in our office. So what fell on me and my partners was we basically had to, for all 2,700 of my patients and 2,600 of my partner's patients, the doctors and our physician assistant, we had to do 100% of every single message that came through. We had to answer or touch or, send back a message in some way. There was very limited and little that the staff could do on their own.
Wow.
Versus other clinics who do have nurses, and nurses then their licensing and training in that healthcare mandates, they have more license to do things. So they can answer messages. They can put in orders for, oh, patient calls up, I need my mammogram. Oh, they just put in the order in the computer, send it off, and then the doctor just has to co-sign it later. But, I'm go from 7 in the morning to 4 at night. Sometimes I run over and I have like a 5-minute lunch. So, so just managing all that. The only time to do that is after work. And so I would spend an extra hour at least at the office answering messages and doing prescriptions as much as I could. I would come home, have dinner, and for a lot of times in the last few years, as soon as the kids went to bed, my younger kids went to bed, 8, 9 o'clock, I'd be on the computer till midnight sometimes, and just answering more messages, reviewing lab work, and and doing a lot of that. And it was, the common term in healthcare these days is burnout. And I'm very resilient. I'm very laid back. A lot of my colleagues and stuff like that, they, a lot of the stuff didn't bother me. But even when I get to the point where I'm feeling like I can't take it anymore, it's got to be bad. So and that's kind of where we were at. And Henry Ford Health System is a great health system. They do wonderful things. But, as with most healthcare systems, they tend to, this is just the nature of a financial organization like that and what they do. They focus on surgeries and inpatient and cancer therapies, and they try to be the best of the best because they have so many other competitors. I felt like, even though we feed everything as primary care, it kind of felt like you're, at the bottom of the barrel, and nobody's, focusing on that aspect of things. And, after years of conversation, and, I just felt like it needed to have a change, and the opportunity here presented itself, and I reached out, and it was very favorable. So
it kind of conflicted with your purpose, what you wanted to do, and how you wanted to spend time with your patients, and make those moments as personable as possible. And so I think you shared that was one of the reasons why you decided to shift over into this new venture, and so that you would have that time. And so we're talking what was it, 2,400 you had, or did you say, or 2,700?
Oh, yeah, the cap for our group is 800. Less than a third of what I've been doing. So just thinking about that, it's like, you feel like a little bit of a weight. Oh, I can breathe.
Yeah, the advantage for that then ties back to my earlier question is about family, being one of the reasons why you decided to go this new direction with Salta. So why don't you tell us a little more about your family, how long you've been married, and how many kids you have, and things of that.
Yeah, so my wife and I met in high school. We started dating then. So we got married in 1994. So this is going to be, this December will be 28 years of marriage, about 36 years of being together and, dating before we got married. So yeah, we've been together a long time, and we have 4 kids. We have 2 older daughters that my oldest is age 23, just graduated from college. My next daughter is 22 and still in college. And then my wife and I waited 12 years to have the rest of our family, and we took a break, thought we were done, and then, God called us to trust in Him, and He gave us 2 more children. So we have a 9-year-old and a 6-year-old.
Wow.
A daughter and a son. So, I was involved a lot in before the younger kids were born, with doing a lot of administration, and even that was a lot of meetings, early morning meetings, late night meetings, driving downtown to Henry Ford, and doing all this back and forth. And so I kind of withdrew from all that and just turned strictly to clinical practice, which probably double-edged sword there. I had not as much drive time and doing all these meetings, but that really allowed me to focus on the practice, and it grew even more. So then I added even more patients over those 6 or 7 years as well. Having those young kids are starting to get into so many different activities and things like that, and we want to be able to do with the family. And I really just saw that the current practice style and how much work I was putting into things I need to put in after hours, and not even with all that extra time being caught up ever. I really wanted to focus on something different so I could have more time physically present. I think I read a study a couple years ago that most active doctors the actual amount of physical face-to-face time that they spend with their children every day is about 22 minutes. That was sad, and
Eye opener, right?
that's abysmal. That was horrible. And you add it up, and a lot of times I start early. I don't even see them before I go to work. They're still sleeping. I come home, and then a couple of hours at most, but it's not always, I'm doing other things with the yard and the house and, different things like that. And, it's very, the time with the kids was shrinking, and I didn't like that at all. So definitely wanted to make a change to have that be a big focus.
That's wonderful. I remember my dad, he worked as a lab technician in Crittenden Hospital. And he was also a pastor. He worked second shift. So while we were at school, he was at home doing pastoral duties. And then he left for the second shift to work when we got home from school. And then we were in bed by the time he got home. And so the only time we got to see him was Wednesday night for church and Sunday for church, really, unless we did vacations and things. So he was committed to both calls of the medical field and the call of God on his life. And so it was quite an experience. As kids, we appreciated the face-to-face time, as you said, with our dad. And it made those moments even that much more special because they were far and few between. So you mentioned your daughter's in college and one graduating, I think you said. Are they going into the medical field by any chance?
No, nobody's at this point has decided to do that. My oldest daughter thought she wanted to for a minute. She even spent some time in her senior year in high school shadowing me at the office, and I think she was very interested. And then when she actually got to college and all that, she had this epiphany of, oh my gosh, I'm going to spend all my 20s in school. It's like, I don't know if I want to do that. So she switched her focus, and she just graduated from the School of Education from Michigan State University, going to be teaching high school level, and she just got a job at Clarkston High School.
Awesome.
Teaching chemistry and ecology. She's very excited. So.
Well, that's sort of in the field, right?
Yeah.
Chemistry, right?
She has, my, kind of like love for the sciences and stuff like that as well. And then my next daughter, she's also kind of has leaning towards the medical field. She's not going to be a doctor. She didn't want to kind of do that. As far as the time and the training and things like that. But she's going to be starting a dietitian program this fall and at Madonna University. So
awesome.
She's very excited about that, and she's been very focused on health and nutrition over the last few years, and it's like, I think she's found her calling, and she's been very excited about it.
That's great. I want to, in just a moment, I want to be talking about Salta and the grand opening that's taking place here, and plug that. But before we do it, I'm very passionate about marriage. I do marriage conferences and things like that too, and speaking to the man and about how to be the leader of the house and all of that from this aspect of leading well. My wife and I will be married 31 years this August. But I'm very excited for you, and congratulations to 28 years, I think you said. But I wanted to ask you, where did you meet your wife?
In geometry class in high school. So, she grew up in Shelby Township, and her parents moved I grew up in Rochester, so I went to the high school, Adams High School there. Her family moved from Shelby Township to Rochester right at the beginning of high school. So I guess that was 10th grade back then, halfway through the year. So she used to sit right in front of me in geometry class. So it's kind of like one of those old stories about, it's like, oh, the little boy who used to dip the pigtails into the ink, So I used to tease her a lot, and she used to, get frustrated with me, and but in a playful kind of way.
Sure.
And then yeah, after the next year, we kind of started dating, and we've been together ever since.
That's awesome. You know, a lot of things are popping in my mind right now. So I had the same similar scenario. I met my wife actually at church, but we were like 10 years old at the time, and we were boyfriend and girlfriend at age 12. So so it goes way back. But my dad pastored the church on Harding Road there, a little church there, and us kids went to McGregor Elementary.
Okay.
Right behind the building there. I'm speaking about this because it's in Rochester, and so there's some history there. Of course, Crittenden Hospital is in Rochester as well. Yeah. And so anyway, that's where my wife and I met, and I was smitten, and the rest is history, pretty much. And so that's a wonderful thing. What you're talking about. Yeah, my wife and I, we used to call each other names and, and stuff as kids, you know, growing up. And it was just, it was a lot of fun. She has been best friends with my two younger sisters. And so that made it a little easier for me. So she's always been a part of the family, and such a blessing. So, but it's very, very cool what's going on with you, and a lot of excitement in the shift, and in going to Salta, and shifting into direct primary care. And so why don't you give us an overview of what's about to happen come August 1st?
Sure. So probably should start with just a little bit of background. So, because a lot of people, still, don't know what direct primary care is, and they haven't heard of it before. So just an overview of what that is, and Salta, and how long they've been around. So Dr. John Blanchard started the Salta group in direct primary care 20 years ago, probably, I think, maybe even 21 years ago. And he and his partners were kind of frustrated with, how healthcare modeling was at that point, with, a lot of dictates and mandates from the insurance companies. Well, the only way that you can, keep your doors open, you have to see more and more patients, and reimbursements were getting less and less over years. And I've seen that, experienced that with, with my father, and his practice. He's been a physician for 51 years. And definitely it's, huge changes in that time frame since 1970 to now, where, more and more restrictions on what you can do. And I've always been, get everything done when the patient's in, but the insurance doesn't like that. So, if you do more than one, so if you do an office visit, you talk about this, you talk about their blood pressure, and then, you have a skin tag, we got to take that off. And then it's like, and there's something else we need to talk about. Those are technically three separate issues.
Yeah.
Three separate things. And, you would have to bring the patient back. I mean, as a physician, if you wanted to actually get paid for each one of those fully, you would have to bring them back 3 times. So, direct primary care, and what Dr. Blanchard and his partners, they asked the patients, what do you want? And they said, well, we want a closer relationship with our doctor. We want appointments that, start on time and end on time. We want more flexibility when we need to get in. We need to be seen now. We don't want to wait 2-3 weeks to get in. And we want to, when we call the office, we want to be able to talk to our doctor. So that's, what they did. They compiled all these, requests that patients were asking for, that they thought would make, a great practice. And then they implemented them. And they did that in the model of direct primary care. So to do that, what direct primary care does is it charges a monthly membership fee, and it's a flat rate. It does not adjust or change, and that covers everything that you have done in the office. And then the insurance companies are completely out of the picture. They don't get billed. So when patients come into the office, everything is covered. So if they come in 5 times a month, or 5 times a year, the price is the same, nothing ever adjusts, and everything that we do in the office is covered by that. So if you do an EKG, a urine test, breathing tests, surgical procedures, A lot of those, extra things in the office, we call them extra things. Those typically are applied to patients' deductibles, and they have to pay out of pocket for those, a lot of times anyways. So, so the direct primary care overall, and a lot of patients, they can end up saving money, even though they're being charged on top of their insurance. They can typically change their plans to have just more catastrophic coverage, and they can end up saving a lot of money on their health care. But then they have the ability to be seen pretty much on demand. So direct primary care also likes to focus on, focusing on the patients. How do you need to be seen? And a lot of times, now, especially with the pandemic, really pushed and drove a lot of the new technologies that came out as far as video visits and telephone visits, and things like that. So, with Salta Direct Primary Care, you can be seen in person, you can be seen by video visit, we can do a telephone call, and there's are a lot of restrictions on those with the insurance companies. So insurance companies never ever pay for a phone call. They had a little bit through the pandemic, but those are starting to dry up, and they're kind of reversing the decision as the pandemic is waning down now. So a lot of physicians, they just don't do a lot of phone call visits because they don't get paid for it. So, and that's time that they're not getting paid for, and they have other things to focus on. So with the direct primary care model, all that opens up, and you have much more flexibility to treat patients as they need to be seen and treated. And we always keep 50% of the appointments open for the day for those same day and urgent. Appointments are longer, so the minimum appointment is 30 minutes, and that's for your follow-ups and rechecks and a little more simple things, physicals and new patients, and even if you need it, if the if doctor feels like you need it, they're hour-long appointments. So, and that's what the direct primary care really offers to the patient. So it's much more true patient-centered care. So there's been a huge push in Blue Cross Blue Shield of Michigan has really been sort of leading the charge at this, creating a structure called patient-centered medical home, that tries to drive some of these things, longer appointments, keeping same-day spots open, and doing all these things that are patient-focused. But still, the reimbursement that healthcare offers is still volume-based reimbursement. So a lot of times it's these great ideas and things of creating a more of a patient-centered experience. They end up falling apart because you're still running around trying to take care of thousands of patients, and you don't have time to implement these in the way that they're truly meant to be. And direct primary care really does allow you to do that. So, and Dr. Blanchard always says, it allows physicians to practice like they were trained and as they should.
So the Salta structure is kind of a one-stop shop for the patient to come in and just be kind of cared for in various places of medicine, would you say?
Yeah, I mean, I think you're offered that opportunity because when you have access to your physician, one of the things is that you can always guarantee to either be seen immediately or by the next day, even after hours. All the patient calls are directed to the physician if it's an emergency. So patients will get transferred to my cell phone personally after hours if it's an emergency. So there's no answering service that you have to take a message and try to get a hold of the physician. There's no other, doctor that's on call for you. There's no other, group in there. So, so that does allow a sense of comfort for the patients that I don't need to go to the urgent care. I don't need to go to the emergency room because I know my doctor knows me the best, and that's where my care should be. Primary care. That's your primary source of care. It should be. I mean, a lot of patients, they call the office and, I need to see Dr. Cardellio. Okay, 3 weeks, 2 months, for some things, longer appointments, those 40-minute physicals, sometimes those are 2 months out that they're scheduled. So access is definitely a challenge for any primary care office that, has a full panel of patients. And And that's why all these offices then hire nurse practitioners and physician assistants, and they end up taking care of all the urgent stuff. And then the doctors do more of the, more complex, care. And a lot of times that's how, the mid-level providers like PAs, physician assistants, and nurse practitioners, they function. They see more of the acute issues in the office, even though they're fully able to see the complex issues. And our PA at our office definitely did that with diabetes and heart disease and all the more complex diseases. But when you offer that ability to know that you're going to get in, know that you're going to talk to your doctor, that alleviates a lot of stress and anxieties, and it actually ends up saving a lot of money in the long run for not utilizing those expensive types of care like emergency rooms. You're not getting out of the emergency room without racking up at least a $3,000 bill. And that's even if you just kind of go in and come out.
Yeah. Wow. That's right. And, my wife worked, typing in and setting appointments in a doctor's office where there was a group of doctors, and it was just chaotic. She couldn't stand this dog eat dog scenario back in there, and then the restraints that was on her and the rest of them to try to meet this quota, and telling the patients, well, you're going to have to wait for a month or 3 months in order to see the doctor. And when I have a need right now, how can I wait 3 months to see a doctor? And it was almost like, they're playing the lottery back there, making appointments for people. And my wife just couldn't, handle the environment because it was so raw. And so I think in what's happening with Salta and this whole new setup is that not only can people call to set up an appointment, but they can call you specifically and say, hey, doc, my arm hurts when I do this, and you're able to meet them right where they're at. And that was awesome. And I appreciate what you said. You said something like, give me a little grace because I have a family too, like don't call me if you don't need to,
I had a lot of patients that were very concerned about that. It's like, they're going to have access to your cell phone? It's like, you're going to be like so busy all the time. I'm like, no, patients are very respectful of that. Yeah. And it's like, I'm on call now. Patients can always reach me after hours. They call the office phone number, it goes to answering service, and they have the option to, get connected to me. So myself and one of my partners is always on call. And, patients are very respectful. They feel bad bothering you, and, even though I tell them, it's like, a lot of times, weekends coming up, I'm on call, call me if you need something, if you're getting worse or whatever. And a lot of times, even with that, they don't want to, they're very respectful. So, and I was joking, I don't know which meeting, were you at the first one or the second meeting?
I think I was at the first one.
The first one? Oh yeah, so I was joking with some of the patients there that, it's like, if things get out of hand, we know how to deal with that. It's like I've done extensive training over the years, and many different martial arts, and have black belt and some. I said, it's like, and my one medical assistant, her son, when she found out that I did martial arts, she's like, oh, he's a doctor and he does all this stuff. It's like, how does he do all that stuff? And then she said her son nicknamed me Dr. Cardellio. So I said, yeah, you're going to get Dr. Cardellio if you call me at 1 o'clock in the morning for a hangman.
Yeah. Sleep. That's awesome.
No, it's like, patients don't abuse that. And I know many other physicians who do that regularly. They give out their cell phone for their patients. They typically have smaller panels, and they're involved in administration as well. But I know several doctors who, they just give out their cell phone to any patient that, they feel is needed, and, you're never inundated. So
that's wonderful. And it's just one other benefit to being plugged into what you're doing, especially because you're actually going to have time to connect with them on a more personal basis.
I always found that you get less calls the more time you spend with the patient, because when you can answer all those questions and give them more information about what to expect, with what they're going through, then they don't tend to panic or freak out about, like, oh, now I was in there yesterday, but now I have this symptom. Well, if you can sort of guide them and tell them to expect that you might get these symptoms in the next couple of days, before you start getting better, then, that actually reduces a lot of, calls and the urgency of things. So the more time you have to spend with patients, the less phone calls you're going to get after hours.
Yeah, and the fact that you know who Susie is, right? You've got to spend time with Susie, so when she calls you, you already remember a lot of her background, and you're able to say, "Oh yeah, no problem, just do this, do that," and from a personal, firsthand experience. And I think that that's a powerful thing for this new. Well, you said it's been around for about 20 years, I think, now with direct primary care.
So primary care has been around. A lot of people know it's a little bit different. It's a different model, but concierge medicine, a lot of people have heard about that, where patients will pay a very high premium for exclusive care from a doctor. And that's not what direct primary care is, but a lot of people think that they're the same thing. But they're very different. And direct primary care, especially with Salta, they would love everybody to have a direct primary care physician as their physician. So they try to make it within anybody and everybody's means to do that with their monthly premiums, and it's very affordable.
Yeah, I'm hoping that the medical insurance industry will see this as a benefit to the patient rather than just to them making money, and that they see this as an opportunity for that, so that those who, even though the cost for going to Salta, the direct primary care is very, very inexpensive, but for the insurance company even to be a benefit there to help supplement that amount. Which again is super affordable, and I was surprised by all that was offered, and you can even get an adjustment if you need one.
Exactly.
And so, tell us really quick about the grand opening in your start for August 1st.
So yeah, things are well underway. The office space is we're going to be subleasing from one of the other doctors in the building that we're going actually back into. My office used to be there for 11 years. At the Shelby Medical Mall at 23 and Shaner. So we're going back in there. Everything's kind of all set up. The staff has been working diligently. So next week I'll be at the office, but not seeing patients, and getting the final things all fine-tuned and getting our workflows worked out. And then August 1st, we already have patients on the schedule, and the patients that have signed up have already been calling, and we've been reaching out to them. And that's, again, part of the personal Salta experience. We don't wait for you to call. We call you. So we call you and make sure that, you're getting your follow-ups that you need. And so we're definitely more active in making sure that patients are not falling through the cracks with things, and getting in timely fashion for their rechecks and their follow-ups. So yeah, we already have patients on the schedule, ready to go.
Wow.
August 1st, Monday, we're ready to hit the ground running.
That's awesome. And you said you call them, and some may think, well, you call them because you're going to make more money, but it's the same amount.
Yeah, no, if they come in 5 times in a month, it's the same amount. So.
That's wonderful. I think that's powerful, and I was just blown away by the whole concept of Salta, and how people can be seen by their doctor, and you're creating an environment. There's a book out called Raving Fans. I don't know if you've had a chance to read it, but it's basically about customer service and all of that. But it's making a difference in their lives and making them feel important. Sometimes even in any industry, because a person walks through the door, we think that they belong to us now, but we've got to continue to nurture that relationship. And by reaching out to them and saying, hey, how you doing today? How you feeling? There's a test that you could probably use. and it's not going to cost you any more, but we want you to come in because we care about you. And so that's pretty powerful about the SALTA model and the direct primary care. And so how many spaces do you know are available still for your particular office? Because, by the way, there is several SALTA offices. Is that correct?
Correct. So most of the offices are in Oakland County. They have Troy, Pontiac, Auburn Hills, Clarkston, and then they have an affiliation. They have a practice in Ann Arbor with the University of Michigan. Victor's Care there that they manage and run as well. So, so yeah, so this is their first kind of extension out into the Macomb area and Shelby Township, and SALTA tries to work with individuals directly. They get a lot of people who sign up with them that don't have healthcare insurance because their employers don't offer it. They have they fall under the mandates for needing to provide insurance for their employers, hairdressers and salon workers, restaurant workers, waitresses, waiters, and things like that. And they can get a lot of healthcare for the monthly fee that SALTA charges. So that really is a good supplement to things. But then they also try to work with a lot of employers, and they have a lot of great data and research that shows that they save the healthcare companies a lot of money, over 20 to 25% of healthcare cost reduction, in working with the direct primary care model versus the traditional insurance payment, reimbursed fee for schedule, fee for service type model. So they try to work with a lot of employers, and then their employer pays for the monthly fee, and it's just part of their benefit, and so it's very beneficial to be able to offer that to patients, and it's becoming more and more popular. There's other groups. SALTA is not the only direct primary care group in Michigan or in Southeast Michigan. It's I think going to change healthcare quite a bit over the next 10, 15 years.
Well, awesome. And there's still openings for your particular office in Shelby Township?
Oh, yeah, that was the original question, wasn't it?
Yeah.
So, yeah, we still have openings, but I mean, every day I have girls will send me messages like, okay, 10 more people signed up today, 20 more people this week. And so, yeah, we're well on our way to the 800. And so, yeah, I would, some people like to say, "Oh, wait and see," and it's like, well, you never know how much things are gonna take off. So I think once people realize oh, Dr. Cardellio is not there anymore, it's like, oh, I need to finally sign up like I said I was going to. So you never know when that's gonna hit, but we have a lot of interest, and a lot of people are signing up on a daily basis. So it's very exciting to see that.
So how can people sign up?
So they can just go to the website is the easiest place. So all the registration for practices are done through the website. It's all online. You can just go to SALTA's website, which is www.saltadirect.com. And SALTA is SALTA direct.com. And currently on their main page, there's a link for my practice, and then there's links for the other practices that might have space and availability as well. And then there's links to go to the direct pages and get more information on the individual practices for Shelby, Clarkston, and Troy and Auburn Hills as well. So, but that's the easiest way to do is just go to www.saltadirect.com. And it's very simple and easy. It's a one-page registration, and you link some kind of credit or debit card to there, and you're all set to go. You can pick your start date, August 1st, September 1st, and whenever I do have some patients who are like, well, I got kind of some other things I need to do, but I'm definitely coming with you, and they're they pick their start date as September 1st. So, but yeah, that keeps your spot in the practice. So.
That's great. That's great. And I think a lot of people are going to find a benefit in this. I had never heard really of direct primary care. I mean, I think I'm one of the millions of people who don't realize that even exists. The traditional form of medicine that's available to us, or medical care, that is been like what we've been used to, and now the direct primary care is available, and I think it's a great model, for people to feel both as a person and instead of a number, and of course to get the care that they need. So this is incredible. Salta offers a lot of things that people would go to the hospital or even their primary doctor for care for, but at a flat rate. And I think that sums it up. Would you say?
Absolutely.
Well, that's great. I encourage everybody to go and check out saltadirect.com. Start being actually seen by your doctor and cared for. And so I hope this has been a blessing to all of you watching. And again, doctor, thank you for being a part of this. And thanks for being a part of Life, Love, and Leadership.